Module 7, Customer Service in Healthcare. Many times we think of customer service as going into a store, being greeted by somebody, and paying for a good. Well, healthcare has turned into something similar to that. We have somebody that's going to greet us as we come in, making sure that our needs have been met, getting services from some sort of provider, and paying for those services in one way or another. Healthcare's changed over the last couple of years. I'm not sure how many years exactly, but where reimbursement for different services has changed now to actually being customer focused. So making sure that the right tests are ordered and making sure that the customer, meaning the patient, is receiving excellent care. There have been different types of people terminated from a position because they have had poor customer service. So this is really a good topic to talk about in this course. Some chapters to read. There's a couple more, but chapters 7, 9, 11, and 13. Notice that you have some reading assignments just to enhance the topic a little bit more. Then you have PowerPoint, Customer Service in Healthcare. There's a couple of videos. We are all the patient experience. There is a lot of push for giving the patients the best experience they can have, wanting them to come back to that facility, as there are actually lots of different healthcare facilities, and why one might be better over the other. Then we have a discussion board focused on customer service. You're going to create a detailed healthcare customer service based scenario, including characters. So these can be fictional. You can create actual verbal interactions between the character and your scenario, healthcare professional and patient, family, colleague, using correct punctuation as if you're providing a script to be acted out. So you want to set the scene and create the drama. The scenario should provide a good picture of the issue and the people involved. So then a response post is then going to respond to 2 different students, as usual, and their scenarios, with your approach as a healthcare professional to alleviate or help resolve the issue. You want to provide details of why you would do the things you say you do, and your thought process along the way. You want to include if you would like to involve other parties or professionals and how they would be involved, and why you believe that this would be helpful. Your response to a situation may not be the same as somebody else's. Use the differences as places to open up and participate in academic discussion with your peers. So you really should be creative with these different scenarios. Come up with something that you can actually think of, or maybe something that actually did happen, but remember from a confidentiality area, make sure that you're not using the same types of people or things that can be found or determined that actually happened to somebody else. Let me know if you have any questions.